Imagine standing up from a chair and the room tilts. Not for a second, but long enough to make you grab the table. Now imagine that happening every time you stand up, or that you feel unsteady walking across the kitchen. Most people assume it's just getting old. But what if I told you that Johns Hopkins balance expert Dr. David Z says most dizziness and balance problems in seniors are treatable, not age-related? Today we're going to unpack what that means, why dizziness is often a fixable medical problem, and most importantly, the practical steps you or a loved one can take to stop living in fear of falling. Dr. David Z is one of the world's leading neurology and balance disorder specialists at Johns Hopkins Medicine, with over 4 decades of research on the inner ear, dizziness, and eye movement control. His work has helped physicians around the world understand how treatable most balance problems actually are. Stick around, I'll explain the single most common, underdiagnosed cause of dizziness in older adults and the simple tests and treatments doctors use that change lives. The myth: dizziness is just aging. Most of us grew up hearing things like, "You're not as young as you used to be," or "Be careful, you're getting older." Those comments create a mental shortcut. If you're older and you feel dizzy, it must be the age. But medical research and clinicians disagree. Dizziness is rarely an inevitable part of aging. Instead, it's usually a sign that something specific and diagnosable is going on. Problems with the inner ear, blood pressure control when standing, certain medications, or neurological issues, many of which are treatable. Why that myth is dangerous? When dizziness is shrugged off as age, people delay evaluation, which increases fall risk, reduces independence, and worsens anxiety and depression. The good news? Once the underlying cause is identified, targeted treatments can dramatically reduce symptoms and restore confidence. I'll show you 3 simple signs you can test at home that strongly suggest a treatable cause. And one of them is so easy, anyone can try it in under a minute. The big 3 causes. When clinicians evaluate dizziness in older adults, 3 categories show up most often: vestibular disorders, inner ear problems. The inner ear contains sensors for balance and spatial orientation. Conditions such as benign paroxysmal positional vertigo, BPPV, happen when tiny crystals inside the ear get dislodged and move into a wrong spot, causing brief but intense spinning with head movements. PPV is common and highly treatable with repositioning maneuvers. Cardiovascular or blood pressure-related dizziness. Orthostatic hypotension, a drop in blood pressure when standing, can make people feel lightheaded or nearly faint. This can be related to dehydration, medications, or autonomic dysfunction. Medication effects and multifactorial causes. Many older adults take multiple medicines. Some drugs cause dizziness as a side effect or interact in ways that affect balance. Often dizziness is multifactorial. A little inner ear problem plus a blood pressure dip plus the wrong med can add up. Why this matters? Each cause has a very different treatment. Treating BPPV is not the same as adjusting blood pressure meds. That's why accurate diagnosis matters. Later, I'll walk through the exact repositioning maneuver for BPPV and how to tell if it worked. No specialist required in many cases. How doctors diagnose it. Doctors use a mix of history taking, simple bedside tests, and targeted investigations. History is king. When does it happen? With movement, when standing, duration, associated symptoms? Then come bedside tests. Dix-Hallpike maneuver for BPPV. A head turn, Jach layback test that provokes brief spinning if crystals are in the wrong spot. Orthostatic vital signs, Gauchierist measuring blood pressure and heart rate lying down and after standing to detect drops. Gait and balance testing. Timed up and go, Romberg, tandem walk. Medication review, a pharmacist or doctor checks for culprits. When needed, hearing tests, vestibular function testing, cardiac monitoring, or brain imaging. Most importantly, many of these diagnostics are low-tech, quick, and can be done in the clinic or emergency room with immediate treatment options available. If you want to test at home, I'll give you 2 safe, simple checks you can try. But remember, these don't replace a medical evaluation. Simple at-home checks. Here are 2 safe checks you can do at home to gather information to share with your clinician. Sit to stand test, orthostatic check. Sit quietly for 5 minutes. Measure heart rate or note pulse, and how you feel. Stand up quickly and note any lightheadedness, how long it lasts, and if you near faint. If you have a blood pressure cuff at home, measure BP lying and standing. Head movement awareness. While seated, slowly turn your head left and right and tilt up and down. Note if brief spinning, seconds, happens with certain positions. That's classic for BPPV. If symptoms are intense or you feel unsafe, stop and call for help. These checks help your doctor narrow down causes faster, and faster diagnosis means faster treatment. If your head turns because of spinning that lasts only seconds, there's a 90% chance a simple repositioning maneuver will help. I'll teach that maneuver next. Treatments that work. Treatment depends on cause. Here's the high-impact stuff. For BPPV, the Epley maneuver or similar repositioning techniques move the displaced crystals back where they belong. These maneuvers are typically done by trained clinicians but can be taught for home use in certain cases. They often provide immediate relief or major improvement after 1 or a few sessions. For orthostatic hypotension, behavioral measures, rise slowly, hydrate, salt intake if appropriate, compression stockings, medication adjustments, and sometimes specific drugs to support blood pressure can help. Medication review and deprescribing. Stopping or changing one offending medication can eliminate dizziness entirely. A careful pharmacist review is crucial. Vestibular rehabilitation. Physical therapy programs tailored to balance retraining help people with chronic imbalance compensate and regain confidence. Fall prevention strategies, home safety, vision correction, strength training. These reduce risk while underlying causes are treated. I'll give you a quick clinician-friendly checklist to bring to your appointment that makes it much more likely you'll get the right tests and treatments quickly. Real stories, real results. Let's put this into a human frame. Imagine Mrs. Ahmed, 78, who had brief but terrifying spins every time she turned in bed. She stopped driving and avoided stairs. Her family assumed it was age. A simple clinic visit included a Dix-Hallpike test, positive for BPPV, and the clinician performed an Epley maneuver. Within hours, she felt dramatically better. After a week, she returned to shopping and walking her grandson to school. Or Mr. Khan, 82, who had near-fainting episodes on standing. A medication review found he was on 2 blood pressure medications that together dropped his standing BP far too low. After adjusting meds and adding education about rising slowly, his episodes stopped. These stories highlight why diagnosis matters, and why Dr. Z's point that dizziness is treatable, not just age, is so important in real lives. If you know someone who's been told, it's just age, pause. There's a good chance they haven't had the right tests. A practical checklist to bring to your doctor. Before we wrap up, here's a 1-page checklist to print or show on your phone at your next appointment. It increases the chance your dizziness will be diagnosed quickly. Symptom diary. When duration triggers. List of medications including over-the-counter and supplements. Recent falls or near falls, dates and descriptions. Home hazards, stairs, rugs, lighting. Results of the 2 at-home checks, sit to stand and head movement. Questions to ask. Could this be BPPV? Orthostatic hypotension? Do any meds cause dizziness? Would vestibular rehab help me? Bring a family member if possible. Clear, specific information makes a huge difference. I'll add one bonus question to ask your clinician that many patients forget. It can fast-track the right specialist if needed. The one bonus question. The bonus question: if this were your parent, what single test or change would you try first? Asking this reframes the conversation toward practical, actionable steps and often prompts clinicians to perform the simple tests that reveal treatable causes. Why it works. It helps prioritize low-risk, high-value interventions like the Dix-Hall-Pike maneuver or an orthostatic BP check instead of immediately ordering expensive imaging that might not help. Dizziness is frightening, but it's often fixable. Remember Dr. David Z's message. Most dizziness and balance problems in seniors are treatable, not age-related. If you or someone you love is experiencing dizziness, document the pattern, review medications, ask the bonus question, and get a focused clinical assessment. Small tests and small changes can deliver big results. If this video helped you, hit the like button, subscribe for more health explanations that actually help, and share this with someone who's been told it's just age. In the comments, tell me, have you or a family member had dizziness that turned out to be treatable? I'll feature a few stories in the next video.